Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Today we are going to talk about very important atypical bacteria, which is known as mycobacteria. It causes the disease known as tuberculosis. So this bacteria is not like typical bacteria. So its structure is very complex. That is a reason when you want to treat these patients with this atypical bacteria, then you have to give more than one medicine in combinations, and this treatment goes that long. The reason is that it's very resistant to the normal antibiotics. So first thing we want to talk about is that how the tuberculosis is spread from one person to other. It's the same kind of contagious disease as the measles or chickenpox we had talked, but it's not that active. So usually it comes in the breathing, or like droplets coming with the breathing or sneezing and coughing. So you have to be careful and keep this patient away from the regular people so that they are not infected by it. So if we talk about the signs and symptoms, the signs and symptoms are very non-specific. Like patients can have starting sweating and they have low weight, they start coughing, they have fever, which is associated with night sweats. So what kind of TB we are supposed to be facing? Usually the most common way is that this bacteria causes the infection of the lungs. So tuberculosis of the lungs is the most common, and there are other places where it can happen. It's like into the bones, into the CNS, even into the lymph nodes. So what is the method to identify these infections? The more typical thing is that you need to have like culture of the secretions, or you can use the gene expert. Although these kind of facilities are not available in the most of the poor developing countries, so they rely more on the x-rays of the chest and the smear of the sputum. So if you want to talk about its epidemiology, the most of this infection happen into the developing nations, especially South Asia and Southeast Asia, and some parts of Africa. Like other countries included in this is Pakistan, India, Bangladesh, Myanmar, Burma, and Thailand. So what kind of medication we provide these patients? Usually for the typical bacteria, we just give one or two antibiotics. But in this, you have to give at least 4 antibiotics in the beginning, which can be continuously used for 4 to 6 months. And then after that, you can decrease the number of medication as the treatment is completed. The most common scenario is that we give the patients ripe, that is rifampicin, isoniazid, pyrazinamide, and ethambutol. So when you give this combination, so it can be very lethal sometime against your liver. So we are supposed to take care of, make sure that there is no damage to the liver and other vital organs of the body. So as I said, that its treatment is very prolonged, like over the months. So there is a big problem of compliance. So some patients, when they improve with the symptoms, they just leave the medication. Other times, sometimes this anti-tuberculosis drugs may not be available, so there is interruption. Or sometimes patients think, I'm fine, and they're not supposed to take it anymore, so they leave. So what is the result for that? We end up having multi-drug resistant tuberculosis. So in this case, we have to use atypical medications along with the typical ones, and its treatment may prolong more than a year. So as for prevention, the most important thing in the developing nations is that we should give the BCG and vaccination kind, so that the majority of people can be saved this problem. There is no other problem. There's no way we can survive with BCG. Although in Western nations, they don't use BCG because they don't have this problem. Although like 100, 200 years, they have been this problem very common with tuberculosis, but now they have controlled it and they are very safe unless they started having HIV, which has decreased the immunity, and it has led to tuberculosis come back, but not that prevalent. So what are the risk factors of having tuberculosis? One of the more important is that if you have HIV, your defense goes down, and even all the other categories where it's decrease in defense of the patient or immunity, it can end up with having the infection. For example, the kids who have malnutrition, the young ones, the elderly, the people who are using chemotherapy, and people who are malnourished, or people having chronic diseases can have ending up in the tuberculosis. So as I was talking about the prevention, most important thing is BCG, and it can affect the testing. If you go into a Western nation and you have BCG, So its testing may be questionable. So it's more for in the eastern countries than in the western countries. Other ways to take care of is that this disease is more prevalent in the poor areas where there's overcrowding. It can happen to healthcare workers because they are exposed to this disease all the way or all the time. So what we have to do, if we can improve the health of the people and housing of the people, as well as decrowd the areas, the chances to prevent disease is more. So how we can make sure that patient is compliant to all these medication and that long one? As I said, yeah, it's a very long running disease, so you have to be compliant. If you're not compliant, you can end up having multi medication resistant tuberculosis. So we have to educate the people so that they continue to use the medication until and unless they are told to stop. So some patients they stop the follow up and they can just leave. So you have to make sure that you have proper follow up with these patients. And the other approach is, if you know the patient is not compliant, you can admit them and inpatients and you can educate them and at the same time give the medication, so that way they can come into compliance and we may have better results. Thank you very much.